The Minister of Health, Sibongile Simelane, says in the project of the constructing a National Referal Hospital, they need a public-private partnership for the design of the project, and doctors can also contribute their views. The Minister made these comments during a consultative meeting between the Prime Minister's inter-ministerial team and doctors at the Cabinet offices yesterday.
The Minister for Health, Sibongile Simelane, speaking during the Prime Minister's inter-ministerial consultative meeting with medical practitioners in the country, praised the forum, saying that they need more forums like that in which they will be able to discuss issues relating to the healthcare in the country, as well as issues affecting doctors.
And I'm happy that the proposed upcoming projects, we are, as a ministry, saying we need people, a PPP that will come with a design. And we think during the design stage is where they will consult our specialists while they build and also operate. So we are also looking forward, how are we going to work together with the private sector and the public sector, so that we make sure that every cent that we spend outside this country, it should be used within the country.
Acting Attorney General Sifiso Khumalo, who was part of the deliberations, said he listened to all the submissions made, and he concurred with the fact that some of the cadres were not present when the legislation was enacted, hence the need to amend the law. And his office is ready to work on the amendment when given instructions by the Ministry of Health.
Another thing that I've taken note of, Your Excellency, is probably the issue of the registrar. Because if you look at the Act, the functions of the registrar are vast. And one might want to think if it's practicable to have the registrar as a public officer, or you need an independent person who's going to carry out the duties of the registrar. But that is for the Ministry of Health to look at, so that when they give us the instructions, we are instructed accordingly. Otherwise, in my view and my assessment, the Act itself is still very much effective if put into good use. And that is why I'm saying we thank Your Excellency for giving us this shake-up as Council, because in as much as the Act is old, but it is still effective. If you look at the clauses, they are very much effective.
What was also discussed during the meeting was the position of Registrar of the Swaziland Medical and Dental Council, that it should be a permanent position. Hence, the Minister for Public Service, Owen Ngumalo, who was part of the meeting, was mandated to create the position for Cabinet's approval. Sibusiso Ngubane, reporting for Swazi TV News, Mbabane.